7 Best Home Remedies for Bladder Infections. Bladder infections are the most common type of urinary tract infection, UTI. They can develop when bacteria enter the urethra and travel into the bladder. The urethra is the tube that takes urine out of the body. Once bacteria go into the urethra, they can attach to the walls of the bladder and multiply quickly. The resulting infection can cause uncomfortable symptoms. Common symptoms of a bladder infection include pain or a burning sensation when urinating, feelings of frequent urination even though your bladder is empty, urinating more frequently than usual, pain in your bladder, stomach, or pelvis, urine that appears cloudy or smells foul. Most bladder infections are classified as simple or uncomplicated bladder infections. These types of bladder infections are typically not difficult to treat and respond well to treatment. A combination of medical and home treatments may ease these symptoms. However, if left untreated, bladder infections can become life-threatening. This is because the infection can spread to the kidneys or blood. Here are 7 effective bladder infection home remedies. Ready? Let's go! Please subscribe down below to keep you updated on everyday health-related tips and best home remedies here on Green Life Hub. 1. Frequent urination. Frequent urination helps eliminate the infection by moving bacteria out of the bladder. However, holding it or not going to the bathroom when you need to, allows time for the bacteria to continue multiplying in the bladder. It may also be helpful to urinate after having sex. Sexual activity can push bacteria deeper into the urethra in both men and women. Urinating after sex may help flush bacteria away from your urinary tract. This prevents germs from settling and causing an infection. 2. Drink more water. When caring for a bladder infection, it's critical to drink lots of fluids to help flush the bacteria out of your bladder. The additional fluids also help dilute your urine, which can make urinating less painful while you're healing from the infection. Water is an excellent choice since it doesn't contain any bladder irritants like other beverages, such as caffeine or artificial sweeteners. Drinking more water can also help prevent bladder infections. 3. See your doctor for an antibiotic. If you're diagnosed with a bladder infection, your doctor will likely prescribe an oral antibiotic. Antibiotics work by getting rid of the bacteria that is causing your bladder infection. Research has shown that antibiotics are effective and perform better than a placebo. You need to complete the full course of the prescribed antibiotic, even when you start to feel better. If you stop the antibiotic before completing the prescription, you risk getting another infection. In an uncomplicated or simple bladder infection, you'll typically notice an improvement in your symptoms within a day or 2 of starting the antibiotic. Your doctor may select an antibiotic treatment course that will last 3 to 5 days. In complicated bladder infections, the course is longer, typically 7 to 14 days. 4. Drink at least 1 cup of cranberry juice daily. Cranberry has been used as a natural treatment for preventing bladder infections for generations. Cranberry juice and cranberry tablets show some promise as a remedy for women who frequently get bladder infections. But it's not clear whether cranberry juice really works for preventing bladder infections in the larger population. Talk to your doctor about cranberry juice as a way to prevent bladder infections. 5. Take over-the-counter pain medications. Severe bladder infections can cause pain in the pelvic region, even when you're not urinating. Antibiotics will treat the infection. Keep in mind it may take a day or 2 before the drugs start to help. Taking pain medications may relieve abdominal cramps, back pain, and any discomfort you may feel. Ask your doctor if it's safe to take over-the-counter pain relievers. Taking acetaminophen, Tylenol, ibuprofen, Advil, Motrin IB, or phenazopyridine can ease pain while you wait for the antibiotics to start working. 6. Apply a heating pad or warm pack. A heating pad or warm pack can help ease the discomfort from a bladder infection, especially at night. Putting low heat across your abdominal region or back may soothe the dull ache that sometimes occurs during bladder infections. This can be especially helpful when used together with your medications. You can buy a heating pad at a local drugstore or online. Make sure to follow the directions on the package carefully to avoid burning yourself. You can also make a warm, moist compress at home. Simply soak a small towel in warm water and place it over your bladder or abdomen. 7. Appropriate dress. Bacteria thrive in warm and moist environments. For women, tight jeans and other tight clothes can trap moisture in delicate areas. This creates a breeding ground for vaginal bacteria. Wear cotton underwear, loose pants, or skirts to promote air circulation and reduce bacterial growth. When to see a doctor. Contact your doctor if you have pain or discomfort when you urinate or other symptoms of a bladder infection, especially if the symptoms have been present for 2 days or more. If an infection lingers for too long, you risk the bacterial infection traveling to other parts of your body, including your kidneys. Therefore, you should seek treatment if you notice symptoms.